Everyone, it's Tammy with Next Level Me, and welcome to another segment of our Spotlight interview series. Today, I'm with Dr. Lulu, who retired from a very successful medical practice after 30 years and is now on a mission to help healthcare organizations build patient-centered practices for marginalized patients. Welcome, Dr. Lulu. So happy to have you today.
Thank you, Tammy. I'm glad we're finally getting to do this. It's been a minute.
Yeah, exactly. It has been. We've been trying to get this scheduled for a while.
Yeah.
So I know you shared a little bit of this with me, but can you share with us what actually sparked your desire to reinvent your career, basically when you were on the brink of retirement?
Well, all the words are true, but not in that order. So I always knew I was going to leave medicine after 30 years. I said that, I made the declaration when my youngest was born, actually. I was like, when I get to 30 years in this doctoring thing, I'm gonna leave medicine. So I was already romanticizing about it. And then I knew the baby was going to be about to go into college around that time. So then I switched and I changed and I said, okay, but I'll wait for you to go off to college because it happened before he went into college. I was like, I'll wait for you to go off to college and then I'm really going to do it. But it was good because by the time I turned 52, when I left medicine semi, he wasn't really in college yet, but then he went into college like the next year. So he's a junior now, and I'm 55. So I think the next couple of years. So I just waited. It was already time, but I was just kind of marking time and playing around with what to do after that. So it was actually more of just a plan. I just planned to do that. I didn't plan to 30 years. To me, I felt, listen, anybody who's done any kind of job for 30 years or less even, you can leave if you want to. And it's just same just through line of me always giving myself permission to do whatever the heck I want to do. So it was time.
Well, cool. Well, that's a great story. So, what went into your decision-making process, both as you were ready to make the change, and then also what kind of decisions did you have to make once you decided to approach the mission that you're on now?
So leaving medicine, like I said, it was already I was already going to do that. Even though a friend of mine took me out to lunch, his name is Emeka. I just talked about him yesterday, and he was like, "So you're leaving medicine?" I was like, "Yes." He said, Are you being sued? I mean, is everything okay?" I was like, "Yes, everything is okay." But I understood because most doctors don't just say, "I'm done," without having any drama. But I think, just because majority of people think a certain way doesn't make it right, doesn't make it true, doesn't make it the only truth. You can leave your job at any point in time. Anybody can leave their job. Doctors or plumbers, don't matter. Anybody can give themselves permission to just leave. And I think I've always thought that way. My dad thought I should become a pharmacist, and I wanted to be an architect. So I said, you know what? If I'm going to go to medical school, then I'm going to become a physician. I mean, it's like I just always dance to my own tune. So I just said, I'm going to do that. Now, of course, the reality was that then what am I going to do? So my ex-wife said, you've been telling me about these kids who are coming and are depressed and are coming and are suicidal and are coming and you lost one to suicide already. Maybe something in that line. I was like, because one day I came home and I said, I feel like there's some kind of smoke coming out of my head, or maybe I smell a certain way because all the kids that are depressed and suicidal come to see me. Like literally, that was the thing. But then my nurse and my ex-wife would say, well, there must be something about you. Maybe they feel safe around you. Maybe you act
Wow.
like them. You're basically a child all the time. A childlike and be like I'm really approachable. It's just easy for them to talk to you. Their parents talk to you. Maybe that's it. I was like, okay, maybe that's it. But I think losing a patient to the big S word, it's never something, obviously, it wasn't my child, but my patients are my kids. So it wasn't something that
Yeah.
was easy for me. But once that happened, I couldn't unsee it. I couldn't, I just like, what happened? Like, how did we miss it? What happened? And I became obsessed about figuring out why this kid unlived himself.
Yeah.
And
That would be
then
hard. I can't even imagine.
yeah, yeah. Yeah. So to the one kid, and then it's not even it's not an aberration. Lots of kids on live themselves, and then the more I started thinking about it, the way the universe works, the more cases I saw of it. When you buy a red car, all of a sudden you just see more red cars, but the red cars have always been there. So I started seeing more and more kids just struggling, and so finally my ex said, since you're so fiercely independent, just start your own practice. I said, no, I've already done that. I already had my own practice. And then she was like, well, what if your practice was just for suicidal youth? And I was like, is that a thing? So we looked and we said, ugh. So I called the state of Texas actually, and I said, I would like to start a private practice to only take care of suicidal youth. And the lady's words were, ma'am, if you want to see only patients born on Cinco de Mayo, which is 5th of May, you
Right.
can, as long as you have a license. And that was beautiful. And I was like, okay, let's do this. So I started that in 2018. I retired officially in 2021. But in 2018, I started the practice because I had left the Air Force by then. And 2020, the lockdown came.
Right.
And then a child who's in crisis, who has mental health crisis, at least in my opinion, I need to see them in person. I need to hug on them. I need to love on them. I just need to be there. So we try to make the practice virtual because Texas did shut down. It's not like some cities that were not shut down. Texas was. So we try to make it virtual. I did my best, but it just was not the same. So I let the practice fold up, and then I decided to get my life coaching certification because to my mind I was like, well, I'm already talking to parents as a physician. I can now start talking to the same parents but as a coach. And so I
Right.
started doing that, and it picked up and it was doing very, very well. I started my podcast, all my podcasts. My first one was Suicide Pages. The next one was The Pride Corner. The next one was Parents of Queer Kids. And then the last one was Moms for Trans Kids podcast. And that's still our current podcast. But in January of this year, we had a change of administration. And then all of a sudden the parents are like, I don't know about coming and talking on your podcast. I don't know if I want people to, I don't know if people are like trying to run for their lives for good reasons. I was like, okay, I get it. I get it. Safety first.
Right.
Well, who else can I talk to that there's a stakeholder in a child's life? And I had 8 P's. They're physician, they're pastor, they're psychiatrist or psychologist or therapist, they're parent, their peers, by proxy, which is their neighbor, and one more. Um, I forget the one, but the eight of them came out, 7 or 8 of them. And I went through that list and I was like, okay, which of these people can I begin to speak to and coach? And of course, naturally, the first one was doctor, because that's who I am. So I was like, okay, well, let's see how we can begin to speak to physicians. What does that look like? And I started posting about it and then posting about it some more. And one physician said, since you're moving to Georgia, would you like to speak to the Georgia State Medical Association at the conference? I said, will I? Are you kidding me? Yes. And then so I did one and then another and another and a sister and a brother because as I told Oprah, I'm the only one that I know who has this lived experience, who is doing this work, who looks like me.
Right.
I don't know if there are any non-blacks. It doesn't matter because my kid is black. So the black people need love, and that's the truth. So while I'm not necessarily speaking to black physicians, I am black. So people that listen to me tend to lean in because they are black as well. Anyway, the point is that's how that happened. So I just did one and then I did another, and people are like, well, do you have a course or do you have something that we can? I said, no, because I didn't have no, I don't. Do you have a book or something? I said, no. So, okay, I guess we need a course or something. And that's where the idea to create a program to actually train these doctors to know the things that they need to know, as the verbiage or how to comport themselves or how the patients can find them online or how the patients can feel safe around them or how the patients can trust them. Most doctors, actually, my brand new course that I just taught on Tuesday is titled, last night is 28th, is titled I don't want to say the wrong thing because that's what
Mm.
majority of doctors tell me. So you know what? I
Yeah.
just don't want to say the wrong thing. So they don't say anything. Well, in the
Yeah.
silence lies trauma. In the silence lies bias. In the silence lies all the things that the patient doesn't want. And then the last question I ask them is, who gets to decide what's the wrong thing?
Mm. Very insightful question.
Yeah. So if I, the patient who happens to be queer, if I don't say it's wrong, then it's not wrong. So what, when you say you don't want to say the wrong thing, what are you really saying? But more importantly, what is the patient hearing?
Right.
So I found out that there was just like fertile ground on there to just go to town. Next week, Thursday, I leave for Grenada to speak to the Black Psychiatrics Association because they're having their annual conference. So I mean, it's just been like it just took a life of its own. The course, the training, and then people are like, "Oh, well, I don't know anything about that, but yeah, but you're such a successful speaker. Do you ever coach people?" I'm like, "No, but I can." And then now I have a brand new program called Stage Ready, speaker coaching program for physicians who want to speak about whatever they want to speak about. So 2 days ago, I signed my seventh client in that realm.
Wow.
So I mean,
Congratulations. That's
it's
awesome.
definitely just, yeah. Thank you. So retiring for me became a thing that I needed. I'm so glad I did. And I'm so glad I had plenty of time to prep myself because being a doctor is what I call having a golden noose or platinum noose around your neck. I didn't take a lot of loans. I had a full scholarship to med school in Nigeria, but many doctors in America, they retire with, I don't know, 400,000, 300,000. That's the price of a house loan on their heads. I didn't have that. So I can see why leaving medicine for some is like, have you lost your mind? But I don't have a loan. We don't have the same story. So I
Right.
can leave medicine if I want. Because after 30 years, I'm at 35 now, but after 30 years, heck yeah, you can do medicine if you want to. And then the other thing that a lot of people asked me was like, well, do you have enough money? And I was like, how much money is enough? If you say it's enough, it's enough. And I've always just been that kind of person. If you say you have enough money, you have enough money. Like I said, my baby went off to college. The kid is a junior now in college. The other two are grown and flown and doing their thing. So I live by myself. I just have to feed myself. Like that's it.
Right.
So it's been
Right.
a beautiful journey. I cannot, looking back, and many times I forget the minutiae until I'm on a podcast like this one. But looking back, I'm so glad that I did it when I did it. In fact, I wish I did it sooner. Like we always end up saying that. But I'm just
Right.
so glad that I did it because, yeah, why not?
Yeah. Well, you
If it's
had to
not
leave your
working
medical, yeah, you
anymore,
had yeah, you had to leave your medical practice to actually soar with all the strengths that you have. And I mean, I think you named off like about 8 or 9 different passion projects in there that you're working on right now. So that's
yeah.
phenomenal. Glad that
But
you
I
had the
think,
ability to do that.
but Tammy, I think that there's truth in what you're saying. 98% of it is true. But to make it 100%, everyone is multi-talented.
Agreed.
I have been
Totally
in an
agree.
yeah, I have been in an indie movie. I played myself in an indie movie that was very successful, and they're going to be shooting part two soon. I played a Nigerian mom. That's my natural. One person that they did the interview. I don't know what they call it in the acting. I can't think of the word now. In the acting, when you come and they check to see if you read the part or whatever.
Right.
They're like, man, as soon as you read for us, we knew that role was yours because that's who I am. So I think we all shortchange ourselves by thinking
Agree.
we can't do it all. Yeah, like I said on my Facebook a few days ago, dear current self, you can do all the things, you just can't do all of them at once. Sign your future self. I mean, I know that. So, but
Beautiful. I love
yeah, but
that.
exactly. But you were never going to know unless you first try. But how do you try? You have to first believe. And I told a client that yesterday. I said, when a toddler wants to walk, when a child, let me rephrase that, when a child wants to toddle, because toddle is actually a verb. When the child wants to toddle, what they're doing is that they see something across the room and they want that thing. And they don't know how to get there. But let me see if I take one step, maybe I will. And then they take one step and they fall. But I've never seen a toddler that remained on the ground. So
Right.
what happened between toddler age and, in my case, 56? What happened to that radical self-trust we had when we were toddlers?
Yep.
People gave us their own limited vision, their own obscured, is that the word? Yeah,
Yeah.
obscured, whatever.
Yeah.
Yeah, people decided to project their own limiting beliefs at us. You can't do that. Who told you you can do that? How dare you? Who told you that? Girl, bye. Like, why would you want to do that? Like, and then what do? You begin to believe them. But the toddler, you cannot keep the toddler from going where they want to go. And then one day they take off and they're running. And the parents are like, oh my God, did you see that? Did you see that? And also, the flip side of that, when a child is trying to walk and falls, what do we do as parents? Oh my goodness, you're so good. Great job. Oh my God, you can do it, right? But when he's an adult, yeah, that's why you fell, because you can't do it. What happened? So I do not subscribe to that. I don't.
You and I are right there together. I 100% agree to that. I try to tell our clients all the time, don't bury your talents. Go back to like who you were. Think about when you were a child. Think about all the things that you loved then. Think about all the things and all the dreams that come into your head, and forget about those people that squashed them somewhere along the way and told you something needed to be different, because those are voices playing in your head that aren't even your own. That's somebody
Yeah.
else's voice trying to tamper you down. So
Yeah, I mean, and I could even add that it's your voice, but it's somebody else's words. And I
exactly.
because the
Yeah.
reason why we believe it is because it's our voice. Our voice tells us at this point it's a mature voice. And
Yep.
so what I do in coaching when that voice, because it comes to me. So when the voice comes and says you can't do it, I pause and I smile and I say, well, what else is true about Dr. Lulu? And the first thing is that I have done things that my brain told me I couldn't do.
Yep.
Okay. And then the more you say that, the less that voice, the more it recedes into the background because you have now said, actually, I can.
Yep.
So,
Very, very true.
yeah.
So you've already imparted several words of wisdom, but for those people who are still listening to the voice that someone else put in their head, what advice would you give in terms of what you've experienced and what you've overcome and what you have succeeded in? What advice would you give to someone who's standing at their crossroads trying to decide whether or not to quote, take a risk on doing something totally different from what they're doing now?
I will say what the great Jack Canfield said in the book Success Principles. I want you to take 100% accountability for your results. That's it. I'm not going to tell them to do it. I'm not going to say, I'm a coach. I'm actually like a
Yep.
certified, like I went to school for coaching. So I'm not going to say do it. And I want you to take 100% responsibility for your results. That's it. Sometimes you say enough by just saying the necessary words.
Yep. I think
The
that's
person,
very,
yeah,
very wise.
person who is thinking is going to hear. And the person who is not thinking, and that's a them problem. But just tell them, just remember, you are 100% responsible for the results you get. And Jack Canfield actually it puts it so beautifully. He says, people always complain about the things that they can change. When they say, when they get to work and say, "Oh my, oh, this weekend, oh my goodness, my mom was at it again, or my husband was at it again, or whatever," and then they get to work, "Oh, my boss was at it again," and no, the truth is, you can quit the job. Tell your parent that this is, we need to have this conversation. What you don't want to do is you don't want to go through the emotion that comes with taking that quote unquote risk. I don't call it risk, I say just doing the thing, right? I have this thing right here on my table from the book, The One Thing. It came with the book to keep me
Mm-hmm.
focused on always doing the one thing that's going to take my business further, which is why I put a post today on Facebook. I said, I'm going to do I have a dream that I'm going to host my upcoming play at the Fox Theater in Atlanta, Georgia. That's all I need to believe that it's going to happen at the Fox. I don't care if other people don't believe it. That's a them problem. But the day I do the play at the Fox, I'll send them an invitation. Simple. So I just believe what I believe. And I believe that the dreams are given to us because we can birth the dreams. That's why it's given to us. I call myself the limitless mindset coach, limitless confidence coach, doula of dreams or dream doula. I mean, because I can help you birth your dreams. But first, you got to go through labor. And if you've had a baby
Yep.
before, you know that labor is not fun. Yet we have 5 babies, 7 babies, right? People have, right? So while labor is not fun, people do it.
Yep. Exactly. Exactly. That's awesome. So this is the question I always like to end with. And I think you already alluded to it earlier. If you're, let's go back to your former self in your medical practice. If she had one thing to say to you now, looking at who you are now, what do you think she would say?
I knew you'd do it.
That's
Because that's
awesome.
because yeah, because that's what that medical self said to the pre-medical one. I knew you'd do it.
Yeah,
And that's what the pre-medical one said to the child one. I knew you'd do it. When I got a full scholarship to medical school, I knew I would get a full scholarship to medical school. I didn't, it was there's no question about it because I didn't really want to go to medical school anyway. My dad said, why don't you do something more feminine? I said, what does that mean? He said, well, architecture is for men. I'm like, if I'm gonna go to medical school, then I'm going to become a doctor. I don't want to be a pharmacist. To me, I felt like being a pharmacist was kind of like, okay, I'll take it. Like, obviously, that's not what it is. I'm saying I was 16 then, and I'm allowed
right.
to have thought that way because we know not everybody, nobody can see the future. But as far as I was concerned, I thought my dad was asking me to do a lesser thing. If I'm going to go to medical school, I'm going to become a doctor. So she would tell me, question is what my future self, my $1 million self will tell me now. That's the one. Because that's the girl that I'm trying to become. And I know that if I didn't have limiting beliefs even today, I would have already become a millionaire, which is what I tell my clients. Right? If you could do it on
Yeah.
your own, I've already done it. So of course, recently I hired a one-on-one coach again because I want to get to that millionaire self. Because I know that if I could do it on my own, I would have done it. And I'm okay knowing that I need coaching to get there. And that's the
Yep.
beauty of a good, like my one of my clients said, "Oh, I want you to do this, do that, because I'm her coach." She said, "I want you to do coach me this one." I said, "No, no, no. Guess what? The best coach has the best coachee.
Yep.
The best
Absolutely
professor,
true.
yeah, the best professor is the best professor because he has the best students. That's why
Right.
he's the best professor." So yeah. So I gave her a wink and I think she got it. You have to be coachable. Yeah, you have to be coachable.
Absolutely.
If you don't want to get past your limit. As soon as I told my client, I recently tripled my fees recently. And I told her, I said, I'm tripling my fees. And she was like, oh, she didn't skip a beat. She was just like, oh yeah, you can do it. I'm like, she said, yeah, you can do it. I believe it for you. The most important words. And that next week, I signed my first client, which was last week, Friday. And then 2 days ago, I signed another client at the new rate.
Awesome. That's
But
fantastic.
yes, a month ago when I told people at the open mic, I said, I'm going to make $30,000 in the month of October. I didn't even believe it. But yesterday when I did the math, it was 30,050 for the month of October.
That's
Radical belief.
fantastic.
Radical
That's
belief. So I
fantastic.
love retirement. I love being retired. I love it, love it, love it, love it, love it. It's been fun.
It sounds like you are the antithesis of retired. It sounds like you are living your dream every day, and I am so happy for you for that.
Thank you. Thank you. I think the secret is also the secret is doing it early enough. I like keeping promises I make to myself. I do like that. I like it. And so, yeah, I'll keep the promise. So retirement to me was something that was just like, I'm done reading this book, time to read another book, as opposed to, oh my goodness, I cannot. And trust me, I struggled. It's very difficult to leave medicine because we have this mindset that can I do anything else ever? But I've written 9 books in 5 years because I can, you know? So I love retirement.
That's that's awesome. Well, thank you so much for joining us today. And for those of you who are watching, I hope Dr. Lulu's story has been inspiring to you. And if you have dreams, chase them and just tell yourself you can do it because you will.
Yeah,
Thanks, everyone. Thank you, Dr. Lulu.
you're
Bye bye.
welcome. Bye.